Okay, our presentation is Competency through Simulation, and our group members are Devin Corrigan, which is me, and Shanna Strong. So, the question that was asked to us was, can you provide my group 5, with one example describing how the use of simulation can provide an effective mechanism for improving competency in a given area? The examples could be either from the academic arena or from that of a clinical practice. So, the topic of simulation is used in nursing, is extremely important to us as nurses that are moving into the advanced practice role. It's through simulation that we have garnered the knowledge and skills needed to be successful, autonomous, and safe advanced practice nurses in any setting. Simulation is not only used in the master's programs, but it's also used in the bachelor's programs here at Valdosta State. As a graduate assistant in the simulation lab, I've helped students with simulations such as learning how to insert IVs, learning how to do NG tubes, to running a code blue in the critical care lab. I've seen through these simulations the important improvements the students have made in their skills and confidences as new nurses. Simulation is a part of the nursing education that provides a safe realism opportunities to the students. Simulation is an educational or training method that is used to replace or amplify real experience with guided experiences. It allows the students to get hands-on skills, develop critical thinking skills, and be aware of the patient's safety at all times, and implement thoughts into action. Although simulation is extremely beneficial, it's only as beneficial as the students make it, as it is a learner-centered approach to learning. Simulation has had a very long and intriguing history. While most of us have grown up in a world with technology, nursing education has not always had the access to the great amounts of technology that's available today. Simulation has typically been implemented into the undergraduate programs, but now we're seeing more of a push into the graduate programs. As we know, we are greatly using simulation mannequins. The first life-size simulation mannequin was actually made in 1911 by a doll maker, Martha Jenkins Chase. The mannequin became known as Miss Chase, and the initial use of this mannequin was to teach nurses how to dress, turn, and transfer their patients.
So telehealth simulation has been used throughout the APN program, and we have utilized simulation technology to interact with our peers, such as this PowerPoint presentation, and enhance the patient care that we provide. According to Kim Park and Shin in 2016, simulation education as it pertains to nursing is an effective means to provide students with knowledge, skills, and attitudes within various settings. The new clinical sciences integrate with the diagram that I've shown up here, how system skills, patient skills, and collaborative skills culminate to improve patient care through technology. And through these three skill sets, then we can turn around and use it to work and improve the system even further as technology advances.
So we're kind of steering away from simulation and going more into telehealth and how it affects the clients and APNs. So telehealth is using technology, which we are learning to use in the classroom, and using that to better benefit our clients. This would be like going to a client's home and seeing them there instead of having to send them to the doctor's office, which a lot of people can't get to, such as like your elderly or your migrant workers. So the use of telehealth benefits the community, as in it improves access to care, like I just said, rural areas and elderly, and it increases the time with the provider. As APNs, you're going to have more time with these people. You're in their homes. You're looking at their living situations. You're seeing what resources they do have, what resources they don't have. You get to spend more time with them. They receive more in-depth education on their disease processes and healings as you are in their house, and not on a specific time schedule, like I have to get in this room, get out in 20 minutes, do the diagnosis, do their medications, and go on to the next patient. Diagnostic test results and e-scripts are also able to be seen and sent in real time, so the wait time or the need to present to a medical office for results is eliminated. So that's part of the patient outcomes, is they have the real-time diagnostic results, they get the care instructions, and they get the e-scripts. The educational benefit to the providers is also excellent because they get to video conference with experts in the fields of medicine and learn from them. Not only can you have a conference with someone that lives across the world, but also if you're seeing a patient and need to consult with another doctor, you can do that right then and there. You don't have to send them to another state to get the care they need, which is benefiting them in the long run. Patients have actually reported increased satisfaction with their level of care using this telehealth medicine. The monetary benefits, such as the educations the clients receive, can hopefully increase their knowledge, which will keep about their disease states, which can keep them out of the hospital. In terms of professional monetary benefits, Athena Health, which Shanna uses in her clinicals, allows you to prioritize your diagnosis, since as a provider you only get paid for the 3 diagnoses. So if your patient has 6 diagnoses, you're only going to get paid for 3 of them. So it helps you to prioritize the top 3 diagnoses. Medications are also able to be ran in Athena Health against your insurance, so you can tell right then and there if a patient's insurance is going to cover their medications. And if not, you can choose a different medication for them. So that really saves time and money for the patient, instead of having to show up at a pharmacy and realizing they can't afford the medication that you prescribed them. And either they're going to pay for it and not have money for food and that housing, that sort of thing, or they're not going to pay for it, and their disease process is going to get worse, and they're going to end up back in the hospital.
So technology examples in our APRN program are recording for self-assessment. So early in the program, we did health assessment, and we learned how to examine each other, and we videotaped ourselves repetitively until we were very, very proficient in doing health assessments. So technology in that format and uploading it to the teacher where they could also see what we were doing along with entering in a SOAP note, we could go from the start to finish in an assessment and our diagnoses and labs, and therefore understand what we need to do once we get into the clinical practice. So testing is the next point, and it's with immediate answer feedback in D2L, as long as the instructor has made that a portion of your testing, along with rationale. So it helps us understand why we missed a question, what the correct answer is, and why it's the correct answer. That helps us further our knowledge and skills. Typhon is the online program that we use when we are in clinicals to document our SOAP notes. And the instructors can go back into Typhon and see exactly what we've put in, see the demographics, see our SOAP note, and give us real-time feedback that we can go and scroll and look and see why we missed a portion of what we should have been documenting as far as our clinical experience goes. The patient documentation is real-time documentation in the patient's chart during clinicals, and I'll get into that a little bit farther in the presentation. We also have online guidelines, so I utilize that in my clinicals as well. While I'm talking to the patient, I can pull up online guidelines. I'm in pediatrics right now, and each child age has different milestones, so I can show the parents exactly what their child is supposed to be doing and what to anticipate as far as anticipatory guidelines for the future and for safety as well. And then Galileo for research. We all know that we have to research and provide peer-reviewed scholarly journal citations, and so that's one other way that technology examples are helping us in the APRN program.
So this slide just kind of talks about simulation and education. I'm going to hit on a few points and speak more in depth on those. The ones I don't hit on are on upcoming slides. So throughout the education in Valdosta State University's nurse practitioner programs, students are able to use simulation in many different formats to prepare them for a career as advanced practice nurses. Simulation opportunities give the students supreme access to safe environments for learning. Some examples of how VSU has implemented simulation into learning is through shadow health, pharmacology, assessment videos, nursing theories, and objective structured clinical examinations, or what we all have known to love as OSCEs. So the first one I'm really going to hit on is pharmacology. Although we think pharmacology as just a class, this is a class that gives real-life scenarios in a testing format. The students are able to critically think and determine the right medication that a patient would need. So kind of simulating a scenario and you determining what is needed to be done there. This type of testing simulation is beneficial because of the fact that if we get a wrong answer, we're not harming a patient. But we can learn from our mistakes before we are in the advanced nurse practice, in the hopes that the medication administration to the patient will be as flawless and as safe as possible. The second type of simulation I'm going to talk about in our nursing education is the assessment videos, which Shanna has already touched on. This is done in our health assessment class. We are graded on various assessment videos based on our body systems. During the simulation, you use an actual person, so you're starting to get your hands on education, and you assess them. This type of simulation allows for the hands-on practice before entering the real world, so you're actually getting to interact with somebody instead of just online simulation. This type of video allows us to be critiqued and to rewatch the videos to learn what we did great and what we could do better. So then the last thing is nursing theory. This is in our theory class. A part of this class that I really did enjoy was getting to reenact a nursing theory of our choice. So you got to determine which nursing theory you wanted to use, and then you basically made a video of a scenario in a hospital or a doctor's office, and you would be implementing that nursing theory into the video. And it showed us how to implement the theories, which are the basis of our nursing, into practice for optimal care. So, shadow health is used in the health assessment class. It uses interactive simulation. You get to do it on your own time. You get feedback after you finished with a grade or a percentage of how much you did right. You get the subjective and the objective information from the patients, and you actually get to listen to respiratory sounds, to cardiac and abdominal sounds. So all the patients throughout the shadow health, and this is one of the patients, Tina. They all have varying but very common diagnoses that you'll see throughout practice. Through shadow health, we've learned how to talk to a patient. A factor that we all found extremely frustrating but beneficial is that the shadow health did not understand how we were asking questions. You had to think of a different way to ask these questions, which in real life, people may not understand what you're talking about, and you have to find a different way to make them understand to get the answers that you do need. So that was a good part of this shadow health simulation that will benefit us in the future.
Okay, so to expound on the OSCEs, which again are the objective structured clinical examination, the first step are the skills competencies for each area of study. So health assessment was first, and then we went into adult disease management, and then if you're in the FNP program, pediatrics, and then women's health, and then the last one is capstone. So on each of these stages, you're in an OSCE simulation scenario, and we go from videotaping ourselves to the instructors videotaping us, and you get one take in this situation. And then you go and you write a SOAP note, and all of that is uploaded at the same time, and the instructor goes through and critiques each section on how you did each portion of your exam. Once we learned in the health assessment class that ROS are review of symptoms, and that guides us and customizes each patient's encounter. So the well checks and focus exams that I'm doing right now in pediatrics have built on all of those things, and I go on to dictate the diagnosis orders, the medication changes, or the prescribed and ultimately the plan of care. which all are learned throughout the OSCEs as far as one time, one take. With the standardized patients in OSCEs, we move on to scenarios. So we're given a scenario, whether it's a focused one or just a well check, and that also guides our encounter, which is what you're going to have in the real world. You don't know what's coming in the door, if they're in for a sick visit, if they're in for a follow-up, if they're in for a well check, and then they turn out, oh no, I have an issue today, so then you have to try and figure out how to do both within those 20 to 30 minutes or whatever was allotted for your time. All of these steps culminate into an instructor-student interaction, which is number 4, which is the video feedback and the SOAP note evaluation. So once the instructor goes through the video, stops and starts, and looks at it comparative to your SOAP note, they can tell you where your strengths and weaknesses are. The evaluation allows the instructor and student to review all of that, and then it provides opportunities to improve our skills and competencies so that when we get into the real world, we know what we're doing and we are confident to take care of the patients that we have. So Athena Health Training and Simulation, this is the documentation portal that we are using right now, and it has been my absolute, by far, favorite. So it began with online classes where, once again, I self-scheduled the classes that I needed to take to know how to navigate the Athena Health system. And then there's self-monitoring, so you can go in there, and just like with Shadow Health, you can monitor where you have strengths and where you have weaknesses, where you need to work on a little bit more, and it talks you through. It's an interactive program, just like Shadow Health, where it talks you through how to get to where you need to be for your encounters, your patient visits, previous patient visits, their medications, their history list, and all of those things. And then Athena Health also gives you some research sites so that you can go on and find more information in depth as to what you're doing. So the next step is navigation. Once you go through the basic classes, you have a navigation that is interactive that talks you through how to get through the Athena Health website portal. So you go through chart views, you go through patient encounters, you go through data entry where you're actually entering into a training program, patient chart, diagnosis, orders, and all of those things. Then it moves you on to prescriptions, which are a little bit more in depth. And as Devin mentioned in the previous portion of the slideshow, we are in Athena Health. It's the only one I've seen that allows you to have immediate authorization for medication. So say I put in amoxicillin and it's not covered by that child's insurance company. Not only does it tell me it's not covered, but there's a little site on the side that I can click through Hippocrates, and it will give me what is covered for that diagnosis as well as what's covered within the insurance. So it kind of mingles the two together to where you are not sitting there searching and going, okay, I'll have to call you later. You can immediately enter in that e-script, and that patient can leave and go and get their medication. The prescriptions are evidence-based. There's dosages for adults, there's a dosage for pediatrics, there's dosages for renal and liver issues, and for the geriatric community, which all of that leads into computer competency. So if you're in front of a patient and you're fumbling through, you're not sure where you're going, they start losing their faith in you as a provider, even though it's not provider-centered, you're computer-centered. And it allows you, while you're speaking to them, hey, do you remember what I took the last time? Because that worked really well. You can look at a previous encounter. You can facilitate a timely appointment. There's clear, concise documentation. And in the practice I'm in right now, we carry our own laptop. So I can put the laptop to the side. I can close the top down. I can speak directly to the patient. And then when they ask me a question, I'll say, let me look that up. I can open it up. I can go in Athena Health, find what I need immediately, review that with them, and then close my laptop again. So I'm making the interaction personable, and it's not all about me looking at a computer the whole time, which has been an issue in some instances. So taking all of the Athena Health training and moving it into the practice setting, you're documenting in real time. Everything is there. So if you have a referral, If you have a patient that has to go and be admitted to the hospital for an emergency procedure, which is something that we have had happen twice in my practice, clinicals, everything is in there and it automatically is sent to the provider specialty that this patient is going to. You have the ability to upload the referral encounters and the plan of care immediately, real-time prescriptions prior to authorizations. We've already spoken about that. We have the ability to interact and message with other clinicians within the practice. So there is actually a text message on the side where you can message the nurse practitioner that is your preceptor and say, hey, I think you need to come in and look at this patient. I think something else is going on. I think something else needs to be done. And instead of me leaving the room and going and searching, he can come right downstairs. He can come right from the other part of the building, and there is no lag time. And the patient doesn't feel like they're sitting and waiting and waiting and waiting. Again, the Hippocrates access by AthenaNet has been awesome. And I also have within this program at this clinical site, I have Hippocrates website access as well, as long as I'm a student there. So the big difference is Athena helps ongoing knowledge, hands-on, trend watching, so they see what's going on and what your practice needs, and they will build the program specifically for what you need. And then profitability. So as Devin said earlier, the top 3 diagnoses, you can move them anywhere you want within the system, and which ones are prioritized. While they all are important, the ones that are most prevalent can be utilized. Okay. That's it. Thanks for watching.